Endymed's new iFine handpiece is intended to treat small areas such as the periorbital and perioral areas. When treating the periorbital area, it is recommended to divide it into 3 sections: under the eye, under the eyebrow, and above the eyebrow. When treating the perioral area, it is recommended to divide it into 2 sections, right and left. Do not treat over the temple area. Connect the iFine handpiece to the left connector when looking from the rear side of the system. From the main menu screen, select Facial Tightening. From the Treatment Area menu, select the periorbital area. If asked, select the iFine handpiece. The system will automatically provide the default parameters for the treatment. Energy ranges from 1 to 6 watts. Before starting the treatment, make sure that the patient's face is completely clean and that there are no makeup, moisturizer, or other cosmetic product residues. Apply gel on the first treatment area. It is essential to have a sufficient amount of gel, 2 to 3 millimeters, at all times on the area during the treatment. It is important to add gel to the treated area every 1 to 2 passes in order to ensure enough gel is present during the entire treatment. Press the Start button. Pull the skin as much as possible away from the eyeball and spread the gel. This will enable you to treat the fine wrinkles which are close to the eye. Make sure to treat only over bony areas and never close to the eyeball itself. Place the iFine on the first treatment area and start moving it in a constant circular motion, and press the trigger button on the handpiece. A LED on the handpiece will indicate that the RF power is on, and the system will provide an audible signal through the time of energy flow. The audible sound also indicates that the iFine is in motion. Continue the circular movement on the area, going back and forth on the line of treatment until the audible sound stops after 30 seconds. Once the 30-second pass is over, press the trigger again. After 2 passes, check the skin temperature. If the temperature is less than 39 degrees Celsius, increase the power by 1 watt and perform an additional pass on the same area. If the temperature is higher than 42 degrees Celsius, decrease the power by 1 watt and continue treatment. After reaching the desired temperature range, reset the passes counter and perform an additional 6 passes before moving to the next area. Please note, if a minimum of 39 degrees could not be measured, but mild to moderate edema or erythema were seen in the treatment area, complete the 6 passes, then move on to the next treatment area. When completing the first area, clean the gel from the skin and move to the next area. When treating the area below the eyebrow, pull the eyebrow away from the eye as much as possible in order to make sure that the entire treatment area is above a bone. Repeat the same steps as described for the previous treatment area. When treating above the eyebrow, follow the treatment procedure as described for the previous treatment areas. Please note, as the skin in these areas are very sensitive, please take care not to apply too much pressure. If the patient complains of a burning sensation, try to move the handpiece faster, decrease the energy, and apply more gel. Examine the skin for excessive edema or erythema. If observed, stop the treatment and move to the adjacent area. Do not treat in close proximity to the eyeball, and always make sure that the skin being treated is above a bone. Pull the skin in the opposite direction of the eye when treating close to the eye. Patients should have their eyes closed when measuring the skin temperature.